Anna, do you have that?
Oh, sorry.
All right, I am connected. Let's see. Uh-oh, we might be live. We are live. Hey, let me introduce everyone to Dr. Shane Creado, who I adore. He is one of the psychiatrists at Amen Clinics. He is in our Chicago clinic. He is a psychiatrist and sleep disorder specialist. It's a great combination because so many of our psychiatric patients have sleep-related issues. He's an author. He also created a course at Amen University, Overcoming Insomnia. He helped us create Put Me to Sleep, which is just a spectacular supplement that so many people tell me it really works and it helps them. So, Dr. Creado, thank you for joining me today.
Thank you for the invitation, Daniel. It's great to see you again.
So this is part of our Change Your Brain series, which is designed to share with you what it says, what's in our heart and mind. Forget the heart, it's what's in your brain and mind. And then give you proactive advice on how you can feel better quickly. With Dr. Creado today, we're going to talk about insomnia. So what is insomnia? How do doctors define it?
They define it in very complicated ways, as we know, Daniel. But the simple way of thinking about insomnia is not a lack of sleep, but an excessive wakefulness of the brain due to any cause. So when that happens, you're going to have difficulty either falling asleep or staying asleep or waking up too early, not feeling refreshed when you wake up, with daytime consequences, with consequences for your waking hours. And that's considered insomnia.
And what's the impact of insomnia? How does that impact a person's brain and life?
Most people think insomnia is something they can get away with, or if they lose out on sleep for a couple of nights during the week, then it's okay. They might feel a little sleepy, a little drowsy when driving, but that's actually extremely dangerous. When we think about the highest mortality risk in this country, when we think about accidents, cancer, heart disease, all those big ones, sleep disorders or lack of sleep is directly implicated in all of those conditions. So the obvious one is sleepiness, but the consequences play out in every aspect of brain health. If you think about the Bright Minds risk factors, each one of those is directly implicated and affected by sleep. So sleep is truly a pillar of brain health. If you don't sleep right, your brain won't work right, you won't be right.
You know, I think your headphones are banging against your shirt. We just have to be careful not to move too much. Okay. What are some factors that tend to trigger insomnia?
Anxiety is a big one, especially in the environment we're living in today. Anxiety is a huge factor that will sabotage your ability to fall asleep. Another big one is routines, bad habits. Your brain can't just switch on and off, as we know. And so we need to be very, very cognizant of what we're doing in our waking hours if our sleep hours have to be sound. So good wind down routine, avoiding screens, the simple things that we do all add up when it comes to sleep. Psychiatric illnesses, every single category of mental health issues, when it comes to depressive issues, anxiety, PTSD, OCD, addictive disorders, all can impact sleep. Pain is another big one that impacts your ability to fall asleep and get good quality of sleep. Sleep disorders like sleep apneas, circadian rhythm disorders, restless legs. There's a whole other category of sleep disorders that can sabotage your ability to get good quality and quantity of sleep. Hormonal
So,
imbalances.
I think of, and I always try to think of things as simply as possible. It's, if you want better sleep, you have to, one, love it, right? You have to know how important it is. Avoid anything that hurts it, and then do things that help it. And you were talking about some of those factors that hurt it, like not caring, caffeine, alcohol, which surprises people, but it'll put you to sleep, and then your neurons will rebound a few hours later. Plus, it's a diuretic, so it's going to disrupt your sleep. If you have to go to the bathroom in the middle of the night, a warm room, a noisy room, a light room, gadgets before bedtime, or if you have sleep apnea. A lot of people don't know what that is, but you snore loudly, you stop breathing at night, you're chronically tired during the day. So common. How many people have sleep apnea?
It depends. They say between 4 to 15% of the population has sleep apnea, but I suspect a higher number of people have just hard breathing, difficulty breathing. So they're not really diagnosed with sleep apnea, but still their brain is being suffocated and deprived of oxygen, and they wake up exhausted. So whether you consider it to be mild or not, if it's a problem for you, it's a problem for your brain.
Well, you've seen enough SPECT scans now with us where you can almost pick out the sleep apnea people on the scans because their parietal lobe, top back part of your brain, it looks shrunken, and sometimes it'll have holes, not physical holes, but functional holes. And that's actually one of the first areas that die in Alzheimer's disease. So sleep apnea is not a small problem at all. So if it's love your sleep, avoid things that hurt it, do things that help it, what are the things that really help people get the best night's sleep possible?
We need to understand that we need to go back to our basics. Just allow our biological rhythms to do what they're supposed to do. Avoid anything super activating around bedtime. Have a nice wind down routine. Have a daily download before, when you come home from work, for example. Write down your worry list and your to-do list so you don't have to stay in bed worrying and doing those things. Allow your brain to get into a routine maybe an hour before bedtime. A warm shower, some light stretching or yoga, listening to meditation. So your brain gets progressively more and more relaxed as you allow it to fall asleep. Dim the lights around the house. You don't need bright lights at home in the middle of the night or after dinner. You can keep them low and allow your natural melatonin to rise and push you into sleepiness. Associate the bedroom with only calming activities, the bed with only calming activities, and thereby allowing your brain to feel safe and comfortable in that environment. So your pillow, the bed, the position you sleep in is also extremely important. So sleeping on your left side or your non-dominant side, for most people, the left is a non-dominant side, is the most comfortable position. As long as you have the right pillow and the right mattress, so your spine is aligned, you don't wake up in pain.
I'm just finishing a program with the Newport Beach Police Department. And one of the most common questions is, what do I do with shift work and sleep? Do you have any advice?
Yes. One of the books I want to write is going to be on shift work and sleep, because shift work disorder has been designated a probable carcinogen by the WHO. It can be cancer causing. But what I would say is if you have to work third shift 5 days a week, I want you to stick to that routine 7 days a week. Because if we are allowing ourselves normal sleep hours on Saturdays and Sundays, and then third shift the rest of the week, you're actually forcing your body to be socially jet lagged, and it's going to have devastating consequences for your heart, for your brain, for your hormones. So stick to that routine as consistently as possible all days of the week. And number two, I'd say, is strategic napping. If for some reason, when you come back after third shift, you cannot fall asleep and get your required hours, how many hours of sleep is right for your brain, then you can do naps at certain intervals so that you can make up for the sleep that you missed out on at the end of the week. So if you have to stay awake all night, third shift, 5 days a week, and you have the rest of the day off during the waking hours, try and get it in chunks of 90 minutes or 3-hour chunks to make up for your total sleep need in a 24-hour period.
That's so helpful. When do people need to call the clinic and make an appointment with you? At what point? Is it after they've tried these things, they've avoided things that hurt sleep, they do things that help sleep? At what point do they sort of cry uncle and come and get help?
Most of the time they come to us when they have a major issue with sleep. They have excessive sleepiness or severe insomnia, or the partner says that they're acting out their dreams and thrashing around, or they're reported to be sleepwalking, sleep talking. They've really battled restless legs, if they're hallucinating when falling asleep or waking up. Those are all warning signs. This is something seriously wrong. Or they're stopping breathing in the middle of the night that their partner is really concerned about. But also, apart from all those obvious sleep-related issues, I'm of the opinion that every single person needs a preemptive approach to sleep. Sleep optimization, sleep normalization, so that you know what you're doing right and what you're doing wrong. Just as we have annual checkups, I think it's crucial that we have a sleep evaluation so we have a clear direction and path forward. Because even if you are getting 7.5 hours of sleep, it may not be enough for your brain. So I say it should be preemptive, in addition to all those obviously sleep-related issues. But when we know that atrial fibrillation and cardiac irregular heartbeats are directly correlated with sleep problems like sleep apnea, when we know if you're sleep deprived, you're twice as likely to have a relapse in chronic inflammatory conditions like Crohn's disease, and you're more susceptible to cancers and hormonal imbalances and early menopause, I think every single person needs a preemptive approach to knowing what they're doing right, knowing what they're doing wrong when it comes to their sleep.
So those of you who are listening can make an appointment with Dr. Creado. Go to amenclinics.com or call 844-452-6889. And I think one of the things both you and I are passionate about are helping people who can't come to the clinics. And you have a brand new book that's actually doing really well. It's got only 5-star reviews on Amazon. It's called Peak Sleep Performance for Athletes, the cutting edge sleep science that will guarantee a competitive advantage. And I gave Peak Sleep Performance for Athletes a quote, but guess what? It's great if you're a CEO. It's great if you're a manager. It's great if you're a mother. You also developed Overcoming Insomnia at Amen University, and people just loved this course because you really walk them through why sleep is important, what hurts it, what helps it, when to get an evaluation. And I love courses because it really helps people take a much deeper dive. into the subject matter and into your work. What can you say about why you're excited about overcoming insomnia?
When we did the groundwork to create Overcoming Insomnia, I finished all my training in sleep medicine, did special training in cognitive behavioral therapy for insomnia. As we know, I've done psychiatry and mindfulness and hypnosis and neurolinguistic programming and motivational interviewing. And I've combined all of those skills into that series in a very easy, digestible form. So there's 21 videos, roughly 10 to 20 minutes each. And once people sign up for this, it's theirs. They can go to any video at any point and really get a perfect sense of what they're doing right and what they're doing wrong when it comes to their sleep. So it starts off right at teaching people about the stages of sleep, understanding the dangers of poor sleep, understanding what exactly insomnia is, common sleep disorders, downloadable forms to track their sleep, as well as to really assess where their sleep is struggling, everything from health conditions to medications to sleep behaviors and bad thoughts that can sabotage their sleep. And then it lays out a great foundational plan, which includes healthy sleep behaviors, healthy thought strategies, natural supplements for insomnia as well. And the great thing about this, Daniel, is that since people have a permanent membership for once they sign up for this course, they can do it anywhere, online, anytime, and say their sleep improves greatly, and then a couple of months later, bad sleep habits or they're frequent travelers and it falls off again, they can go right back, do another assessment, download the forms, and then once again, they know what works, and then they can implement that immediately. Of course, it also helps people understand through the screening tools that it has if they are at risk for more serious issues, which would warrant an appointment or further assessment for things like sleep apnea, seizures while they're asleep, or other conditions.
It's just so important to have this information. Sleep disorders are one of the major risk factors for Alzheimer's disease, one of the major risk factors for ADD, anxiety, depression, addictions. So if you're struggling with your energy, with your memory, with your mood, with your mental health, one of the first things to fix is sleep. And you talked about natural supplements, and BrainMD for a long time had, one of its best-selling supplements, Restful Sleep, which works so well for so many people. But we actually thought we wanted to try to improve it. And you and our chief science officer, Dr. Paris Kidd, along with me, we created Put Me to Sleep, which is a chewable. And the number of positive testimonials from that has just been so special to me. It makes me happy, right? It makes me happy when things work like we hope. And can you just talk about it and talk about the ingredients and why they're there and how it can help people?
Definitely. I'm so excited about this, Daniel. And every single one of my patients has had such positive experiences. I've started taking it too. It works great. It's also really tasty. So when we set about designing the supplement, it was around 2 years in the making. We wanted something to help people regulate their sleep, not just knock them out. And unfortunately, a lot of supplements out there, you don't really know what you're getting, or you get really high doses of melatonin. You wake up feeling super groggy. So we wanted something clean, effective, that could help regulate your sleep cycles so you'd get the quality sleep that you need, but also wake up refreshed. And so the combination we hit on was vitamin B6 at the right dose, which is higher than your normal daily recommended values because it has huge implications when it comes to serotonin and tryptophan. And as we know, serotonin calms your emotional circuits down. We see that on the SPECT images all the time. It has magnesium in a very useful absorbable form. And magnesium has been shown to increase deeper stages of sleep really nicely. And it's involved in 300 other different reactions in the body. It has GABA to help calm the basal ganglia or your stress circuits down. It has L-theanine, which is also very calming, 5-HTP, which gets converted to serotonin, and very low dose melatonin, because melatonin, even in low doses, is really, really effective in nudging your brain into sleepiness. So it works to help your natural melatonin secretion, makes it more effective, allows your brain to get comfortable and sleepy, get your sleep cycles, and wake up refreshed. So the key is the dosing, the quantities of these different supplements in combination to calm the busy brain down, to prevent over-focusing and overthinking and over-worrying and ruminating about different things, and to take it maybe an hour before your desired bedtime so that it just nudges your brain into calm state, especially if you use those wind down strategies that we describe in the Overcoming Insomnia video series.
That's really great. Well, you know, I'm so grateful for you, for your passion, for your expertise, for your care of our patients. And, you know, I'm just thrilled you're on our team. If you have comments, questions, please leave them on the chat on whatever site you are on. We'll try to have our team answer them for you. Dr. Creado, thank you so much. We're going to be back. We're going to do this Change Your Brain series on a regular basis. So come back to whatever platform you're watching it on, and we'll have notifications. Have a great day and protect the health of your brain, because that will protect the health of your life. Take care.